It was 30 years ago, but it was one of the most exciting days of my life, at least to that point. I had just graduated from college, and I was beginning a new life as an intravenous nurse specialist at a small hospital in southern Colorado. To become an intravenous nurse specialist, you need to do 3 things. 1, become a nurse. 2, work at least 1 to 2 extra shifts with the IV team. And 3, being able to assess the veins of people that you see at the checkout counter of your local grocery store and mentally decide where you would put an IV into their body. After working at the hospital for just 3 weeks, something occurred. My relationship with the hospital, it ended. Not because I was not doing my job, not because I showed up late, not because I wore cowboy boots into the hospital, but more patients were needing to receive their IV medications at home. They could not afford the cost of hospitalization due to lack of money or inadequate insurance. Now with minimal experience, I was to become a mentor for my patients, teaching and supporting them to learn how to put in their own IV medicines. My goal was to turn my patients into proteges. Even a patient could be taught to develop leadership skills. The person who takes a leadership role in their own health care may initially feel insecure or feel unsure of themselves when working with a nurse. But I attempted to communicate with a tone that did not matter and did not make them feel defensive. In providing feedback, the mentor focuses on behaviors or facts of issues. But what if one of the issues was the diagnosed illness might not be the correct diagnosis? How do you mentor somebody on something that might not even be real? This is what happened with my protege, Maria Serra. Maria had a gastrointestinal disorder, feeling full quickly, experiencing nausea, especially after eating. And sometimes the pain in her stomach would just scream in fits of rage. Maria believed that she was diagnosed incorrectly by her family physician. She alleged that even though most of her symptoms were in the area of her stomach, that there was something else happening. She wanted somebody to listen to her. I wanted to help her discover if this was a possibility. She began to give me directions on reading various medical journals and nursing books each day. I did not realize at this moment that I was becoming a protege for my patient. It didn't matter if I was filled with years of academics. It's a serious mistake to believe when you are a patient, always learn from the medical practitioner, because that's not true. Marie began to be a mentor to me in what was right for her. And as her protege now, I was supporting her in her mentoring process. I was being motivated to learn and develop a new understanding of what was really going on within her body. She began to feel fatigued so much that she could not even make it out of bed. Fatigue and flu-like symptoms fall into a category of being a nuisance, but they're not life-threatening. They're so deceptively simple that physicians often just feel comfortable just explaining them away. See, her doctor said it was nerves, as she recently separated from her spouse. He gave her a pill. And time just moved forward, and she began to experience pelvic cramping and more severe pain in her stomach. Her gynecologist addressed it as, undeniably, a stomach problem. So he encouraged her to see a gastroenterologist who advised her that her pain was caused by too much vitamin C. But now I was developing more clinical expertise as my relationship with Maria developed. She was my mentor, Maria, She was taking satisfaction in the confidence of me as being her protege, as I was searching for possible causes. She provided other information to me, and she noticed that her clothes were getting tighter around the waist. She directed me to first talk to other nurses for their recommendations for a new doctor, someone who they trusted. I was instructed to find a location that was convenient to her home. She asked me to make cold calls to physician offices. And I would ask at those offices, how did the office handle prescription refills? How do they let the patient know about what their lab results look like? And how the physician's philosophy of care was. Maria, she was my mentor. She taught me how to find better healthcare providers. Her choice became an internist who was just miles from her home. But he found a pelvic mass using a sonogram, and she received that call that she didn't have a gastrointestinal problem, but actually ovarian cancer. Maria passed away 2 months later. And I still wonder today, what if I became Maria's protege earlier, seeking guidance and support from her? Her goal was to improve her health. There's always something that you can learn from a supportive person with a different experience. Becoming her protege meant I was becoming a better support in guiding other people. You don't have to be an intravenous nurse specialist to contribute to the life of somebody else. As a protege, be inspired to become just a better person in your future.